My name is Hoyne. I'm a consultant psychiatrist, and I would like to report about a paper by Gautam et al., which was published in Global Psychiatry Archives, and it's about mass conversion disorder in schools in Western Nepal, and it's a series of 4 events, and this is an area which has not been having lots of psychiatric support. So it's an area where a new organization is working with the population. So it's a health foundation, Nepal, which is supported by an American group as well. So I'd just like to simply go to the pictures. These are the age of the people. So it's just the ages between 8 and 16, school grade between 3 and 18, and the different areas, which Ghorahi area. The interesting part is that the signs and symptoms, there are headaches, weaknesses with loss of bodily coordination, dizziness, cold arms and numbness, crying, decreased consciousness and unresponsiveness, rolling on the floor, limb shaking, yelling and shouting, limb stiffness, vacant staring, irritable or agitated behavior, shortness of breath, pricking sensation, eye pain, and anxiousness. So there's some variation in that. And the question is, what is the explanation about that? And what people very often mentioned was the spirit, that there's a spirit which affects them. And the patient very often knew someone in family who had similar symptoms, 55%. Most of the patients, nearly 90 or 95%, had previous history of similar illnesses. They had previous episodes in the school as well in the last couple of months. The families were very often not very stable. Parents were divorced in 35%, and separated parents were there, as well as patients where the parent education was not very high. So you find quite a very specific perception of these abnormal behavior, and it's the treatment received was very often with a local shaman, and zero of the people had only mental health hospital contact, and so traditional medicine and psychiatric medicine was or traditional medicine and hospital medicine was only given in 50%. So in total, this is this mass conversion disorder, which is present in some schools in Western Nepal, is very much culturally influenced. It's quite rare in Western society, and it needs further investigation. What the explanation of that will be, and the other thing is whether more psychiatric intervention and the education of people about psychiatric support will make a difference, and if that's any necessary. Thanks for your interest, and I hope if you are interested in similar papers, please let us know and then subscribe to our channel. Thanks a lot. Thanks a lot.